communication is a cornerstone to managing allergic dermatitis because this isn't a quick fix. This is something that needs long-term management, and the better communication, the more empathy that you have, the more trust you have from that client, and the better relationship you have with them.
Hello, everyone. Welcome back to Vetfolio Voice. This episode is sponsored by DECRA and features Dr. Brittany Lancelotti, who joined me to talk about the importance of effective client communication in cases of atopic dermatitis. We explored just how complex and nuanced this condition can be, and depending on the severity, addressing all the different components of atopic dermatitis: itch, pyoderma, inflammation, ear infections. It can all kind of quickly become overwhelming, even for us. So when we add on top of that complexity, explaining all of this to clients, I mean, we're looking at a real challenge here, but I'm sure as many of us have experienced, when we are able to clearly communicate what's going on with a pet and how we plan to manage it, the treatment strategies we have in mind tend to become that much more successful in the long run. As someone who spends her career helping clients navigate atopic dermatitis, Dr. Lancelotti shared her insights into how she communicates with clients about multimodal management plans most effectively. We talked about her approach to creating clear, thorough discharge instructions and the tools she uses, like owner-facing podcasts, to help clients feel informed, supported, and confident in their pet's care. Let me tell you about Dr. Lancelotti. Dr. Lancelotti is a board-certified veterinary dermatologist and a fear-free certified professional. She studied biology at Temple University, then attended veterinary technician school where she focused on animal behavior, before attending veterinary school at Western University of Health Sciences. While in vet school, Dr. Lancelotti earned multiple awards for academic and clinical excellence, including the Dean's Award. After graduation, she completed a rotating internship at Animal Specialty Group in Los Angeles, followed by a residency in dermatology with Animal Dermatology Clinic. She takes a detailed and creative medical approach to care, one that aims to reduce patient and owner anxiety while supporting the human-animal bond. She's passionate about allergic and hormonal skin disease and is committed to helping both pet owners and veterinary professionals better understand chronic skin and ear issues. Dr. Lancelotti is published in the Journal of the American Veterinary Medical Association for her large-scale independent study on the safety of Apoquel. She shares her practical, pet-friendly education through her podcast, Your Vet Wants You to Know, which we talk about several times during this episode, and regularly lectures both nationally and internationally. She shares her home with 3 dogs, including Russell Sprout, a terrier with allergies, anxiety, and Cushing's disease, whose journey helped shape her approach to real-world dermatology care. So much gold in this episode. I hope you take as much away from it as I did. Let's go ahead and jump in.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on vetfolio.com.
Well, I'm really excited to be joined for this episode by Dr. Brittany Lancelotti, and we're going to talk about allergic dermatitis and allergic otitis, some of these sequelae, but I feel like we're going to take a little bit of a different approach from just covering like pathophys and treatment options and things like that to probably one of what may be the hardest part of managing this condition, and that's effectively communicating with owners and getting them on board. So thank you so much for joining me.
I am so excited to be here. Thank you so much for having me. And I agree, this can be one of the toughest challenges of managing allergic dermatitis is just getting everybody on board with the treatment plan. So I think this will be really helpful for everybody out there listening who struggles with getting their owners to buy into their recommendations.
Absolutely. Absolutely. I mean, we're talking about disease processes, for lack of a better word, they're intertwined, they're very complex. There can be lots of different underlying causes, that word we all love so much, find the underlying cause. So I said we're not going to talk about pathophys and all of that, but I lied. Can we can we jump into that first? What makes these processes so complex when we're talking about, diagnostics and multimodal therapy and different types of management?
I think one of the reasons that allergic dermatitis is so complex is because this is a disease that affects many different parts of the body. It's not just one part of the skin or just the ears. We can see the face, the paws, the axilla, the ventrum, the dorsum, perianal skin, anal sacculitis. We can see otitis externa. We can see, facial lesions, blepharitis. There are a lot of different areas of the body that can be affected by this. And so when we have this whole body systemic hypersensitivity going on, there's a lot of things that we have to keep in mind. And it's not just one thing, like you mentioned, that triggers this disease. There can be multiple things that an animal has allergic reactions to. So when we're doing our workup, we're talking to owners about not just, all right, we're going to find the trigger, but when we're trying to find the trigger, we also need to manage all of these things that have happened: the itch, the inflammation, the secondary infections. And it's usually not just one body part, it's multiple body parts. So they're having to do multiple treatments to get all of these areas that have inflammation and infection under control, while at the same time trying to work with us to figure out what their triggers are. And that may be multiple triggers. So it can be really complex for the owner and for us as veterinary professionals.
Gosh, I think you captured it so perfectly there, that there can be this huge variety of presentations, there can be this huge variety of triggers, and a wide variation when it comes to the severity of how these present. And we're talking to owners now about treating this acute presentation that they has caused them to bring their pet in, their pet's shaking their head or chewing their feet or whatever it may be, and addressing that presentation, but also saying, hey, we're going to do this, but we also have to do these other things to identify that underlying cause. And I mean, that can be hard for us to wrap our heads around as veterinarians of, where do we start? How do we effectively address this dog in a way that we get to the bottom of this and we get this under control as efficiently as possible, and we keep the owner on board so we don't lose the opportunity to treat this pet. Knowing, kind of, I guess, continuing to elaborate on the complexity of this disease, when you're talking to clients and trying to explain, we're going to treat what you brought your pet in for, but we also need to go start eliminating underlying causes and figure out where this is coming from. What are some of the pain points you feel like you encounter?
That's a great question. And I feel like one of the biggest pain points that owners come to me with is the frustration over the recurrence of the disease. And for me, managing expectations, I think really helps to lower some of the frustrations that these owners are feeling. And so, one of the things that I always like to ask owners when they come in for their first consult is, what are your goals and expectations for today's visit? Because I want to meet those goals. And by far, the most common answer that I get from owners is, I want to know why this keeps happening. And so I think that's something that as primary care veterinarians, you can start working on right away. You can get them on a good flea control so that they're not having relapses of flea allergies. You can start a really good elimination diet trial by having that conversation with the owner. And if at the end of the elimination diet trial, the animal still has ongoing clinical signs, it's a great time to loop in a specialist to talk about allergy testing and immunotherapy, to now that you have a really good diagnosis of environmental allergies. So having that conversation with the owner about, this is a lifelong condition. Allergies typically are not cured, they are managed. And we're going to work and find out what your animal's triggers are so that we can manage them as best as possible to minimize the frequency and severity of those flares. That's going to go a long way towards minimizing some of those pain points. And I think another pain point that we encounter quite a bit is the complexity of the treatment plans that we are dealing with. This is a disease that it's going to affect multiple areas of the body, and it has multiple triggers. And so our treatment plans, especially in the beginning when we are getting these animals under control and figuring out what their triggers are, it can be very, very complex. what we have found and what studies have shown is that caregiver burden, which is the strain that an owner feels when managing a pet with a chronic health condition, including allergic dermatitis, caregiver burden is increased as treatment complexity increases. And so, if we can find those triggers and figure out what it is that's causing these problems the animal is experiencing, we can go a long way towards simplifying our treatment plan. Imagine this dog has food allergies and it's getting ear infections and it's getting anal sacculitis and it's having recurrent gastrointestinal upset and it's getting bacterial folliculitis. You have to treat all of those secondary things. But once you find a diet that works well for that dog, that treatment plan, it just simplifies so much and makes the owner so much happier because their pet is better managed. So another pain point is that complexity, and it really drives home the importance of figuring out what the animal's primary triggers are.
That's such a great way of thinking about it. I always kind of joke, I don't know, I'm going to bare my soul a little bit here. When, if we have, say, like a superficial pyoderma, and I say, okay, let's do a medicated shampoo, but I'm going to need you to bathe your dog 2 to 3 times a week until this is resolved. And it might be, 2 or 3 weeks until you really see a lot of improvement here. So you're going to be giving frequent baths, and this will be, 60-pound dog. And they're like, yeah, no problem. And I'm like, really? No problem. That would be a problem for me. I don't know
Yeah.
that I could comply with that treatment plan. And we're just talking about baths in that regard. So, I really have a lot of empathy for owners that do have very complex treatment plans to manage their pets. But I think you captured that really well when you said that really speaks to the importance of why we need to go down these routes to find the underlying cause. For me personally, I found it takes a little bit to get owners on board. I feel like I have to plant the seed a little bit in the beginning and say, hey, this is not going to be a one-off. Like, you're going to be back. We're going to be talking about this more. We're going to do more things. And they're like, no, no, no. We're just going to treat this ear infection and move on with our lives. I'm like, okay. And about the third time, I'm like, remember how we talked about that diet trial? Let's have a more serious conversation. So, kind of helping them get on board gradually, and like you said, setting the expectation that this is going to be ongoing. And when they start to see it for themselves, say, okay, now let's go down this route of finding this underlying cause. So you don't have to come see me every 6 weeks, because I love to see you, but I don't think you're as excited to be here as I am. And usually they agree with that.
Yep, absolutely. And I think you're right that planting the seed, it's really important. And I don't get owners to buy in every time I talk to them about allergy testing. But if they're coming to see me for 18 months and the animal's still not really well controlled, that conversation that maybe we had 18 months ago is still in their brain. And I eventually we get to the point where they're on board with doing some of the things that I'm recommending. And honestly, as a dermatologist, I read through the medical records that come to me from my primary care veterinarians when they refer patients over to see me. And I see, had a conversation about diet trial, had a conversation about allergy testing. That gives me some empowerment as a dermatologist to then say to the owner, hey, Dr. Jones talked to you about doing that diet trial, a few months ago. Tell me a little bit about why we were hesitant on starting that, or, what your concerns were, because that's a really great recommendation. I want to dive into that a little bit deeper. And so for me, I try and put it back on the owner and say, hey, I know your vet recommended this to you. This was a great recommendation. It gives the owner some encouragement that their primary care vet really knows what they're doing and can go back to them, because a lot of times I see owners that are frustrated that the disease is still there. And so rather than them blaming the primary care vet that the disease is still there, I'm going to shift that and be like, they did try and work with you. They really did a good job of having that conversation. Let's revisit that conversation because that was a great recommendation.
And from the GP side, I love that. Thank you for the backup there. But I love the way you worded that too, to say, tell me a little bit more about that. What were the hesitations that made you not move forward with that at the time? I have one patient who I know she would benefit from a prescription diet, but she won't stay out of the compost bin and she goes to the neighbor's house and all of this. And the owners say, I just absolutely cannot make this the only thing that goes in her mouth. She's into everything, and she's, constantly here and there and everywhere. And they have these barriers that are very real to them for that. So I think it kind of gives the pet owners permission to be very open about what their hesitations are, because not to say that we can't address the barriers and still get that pet on an elimination diet, but to let them know that yes, it's understandable that this is something you might hesitate on at first, but now we're seeing the importance of it. Let's go ahead and move forward with this conversation.
Yeah, it really is about empathy for those owners, and giving them the space to have that open communication. We can't troubleshoot problems that the owner is having at home if they don't feel safe communicating those problems to us.
So, along those lines, do you have tips in particular when we're communicating diagnoses, complex treatment plans? And we've talked a little bit about expectations already, but anything to add there that can make those conversations go a little bit easier?
Yeah, there's a concept called motivational interviewing, and they use this in human healthcare as well. It's a way to have the owner identify their own why of change and get them involved in accepting that change and being an active participant in implementing change in their home. And so a lot of that is reflective listening, empathy, and making sure that you're partnering with the owner rather than just giving them these recommendations and then walking out of the exam room. So I acknowledge the hard work that the owner has done, because many owners will come in and say to me, I've cut out chicken in the diet. I wish I had $1 for every time an owner told me that they cut out chicken, because my student loans would be all paid off.
I'm telling you.
But it would, it really helps the owner to recognize they're on the right track. But now that they're here with a medical professional who has some expertise and that extra level of knowledge, I ask them if I can give them some guidance and how to really do a well-performed elimination diet trial. And once they're open to those recommendations, that's when I start talking about how to do that diet trial really well and ask them if they have any questions or concerns about being able to implement the diet trial at home. The other communication tool that I really like to use is the podcast that I host called Your Vet Wants You to Know. And there is an episode that is absolutely one of my favorite episodes. It is all about diet trials, and it goes through some of the most common pitfalls that owners have and areas where diet trials might fail. And my client compliance for diet trials has just skyrocketed since I've started using that tool. It is part of the owner's treatment plan. Is they are supposed to listen to this on their drive home from the clinic, and any concerns that they have about being able to do the diet trial, they can then communicate to me, and I can have my technicians help them with troubleshooting those concerns. And so it's a great way of being efficient in the clinic, but also being empathetic and communicative towards those owners.
I love that idea of using a podcast episode to really explain it, because to get owners on board with something like a diet trial, for example, it can require a lot of conversation and a lot of time. And, that's challenging in any setting. I know I can speak from the GP setting that it can be hard to really have enough time to sit down and create enough trust in that communication to say, okay, we're going to move forward with this step and feel confident that the owner understands what they're supposed to do and how to make this successful. So I love the idea of providing an external resource that says, let's take it out of this brief conversation that we have here and expand on this information that you can access when you have time and you can really focus on this, like the drive home from the clinic is a great example, and then go back and answer questions. That's just such an efficient way to communicate and probably get more accurate information to the owner in a way that they can really wrap their head around, rather than trying to remember everything we talk about in that exam room consultation.
Yeah, it gives them the opportunity to find a time where their brain works the best. I know some people that they get overwhelmed in the exam room and they forget a lot of stuff that we say. So that's why we write it down. We have the technician go over it. And so that's 3 times just while they're in the hospital that we've reviewed the information. Then they can go home, they can read the care instructions again. They listen to the podcast when they are feeling most able to digest that information. That may be while they're washing the dishes, that may be while they're sitting down at the end of the day and they really want to focus on it. It may be while they're driving, but it's on their terms when they can best handle this additional information.
Absolutely. And that was a perfect segue because I want to talk about writing it down and doing discharges because that can be another sort of pain point that, how much information do we give them? How do we get all that information to them effectively in a way that's really individualized for their pet? So I want to go down that road. And to start off down that road, can we talk about otitis externa? Because I understand from you that you kind of treat otitis externa as its own separate entity when we're talking about communicating with owners and discharges and things like that.
Yeah, I get a lot of referrals for severe chronic relapsing otitis externa. Our clinic name is veterinary skin and ear. And so, people find us because their animals have problems with their ears, or, our referring veterinarians know that's something that we really are passionate about. When we talk about otitis externa to our clients, I don't talk about it as, oh, your pet has an ear infection. I really want to break it down for these folks because oftentimes these are the owners that come in with the highest level of caregiver burden. I mean, it is not uncommon for me to have owners break down crying in the exam room, which is crazy. I'm a dermatologist, you know? So it's to have people have that level of frustration and angst and depression. I mean, these people's lives are overwhelmed. I really want to help them understand how we're going to approach this and make their life and their pet's life better. And so I break that down using the PSPP classification system. That stands for primary, secondary, perpetuating, and predisposing causes of ear infections. Our primary disease is the thing that causes the bacterial or yeast dysfunction in the ear canal. And that most often is going to be from allergies. So, food allergies, environmental allergies, a combination of the two causes inflammation in the ear canal that leads to a secondary infection. Now, there are other things that cause primary diseases as well, things like hormonal diseases like hypothyroidism and Cushing's syndrome. We can have keratinization disorders, sebaceous adenitis. We can have autoimmune diseases. There can be ear mites or other infectious causes. We can have ear masses as well. But overwhelmingly, especially in our dog patients, the most common cause of otitis externa from a primary disease point of view is going to be allergic dermatitis. So that's where I have a conversation about working on finding out the primary trigger. Then we have our secondary infections, and that's bacteria or yeast or a combination. And this is where cytology is very important because those secondary infections are going to change very quickly, either in response to treatment or response to progression of the disease. And that's why we emphasize to clients we need to perform cytology on these ears at every visit so that we can make sure that we're headed in the right direction. And then we have our perpetuating factors. And this is where things get more complicated. And I see a lot more of these perpetuating factors in animals that have these chronic inflamed ears. This is going to be the changes of the anatomy of the ear canal as a result of that chronic inflammation. So we can have fibrosis and scarring. We have loss of epithelial migration. Normal ear canals have this beautiful self-cleaning mechanism that gets damaged when there is chronic inflammation. And so they can't clean with that normal epithelial migration from the eardrum out to the opening of the ear canal. The owner has to be responsible for that cleaning and removing the debris. Another perpetuating factor is excessive production of debris. So those glands that line the ear canal are pumping out way more cerumen, way more earwax. And that is a perpetuating factor that's going to make it tough for those secondary infections to completely resolve. And then we've got more serious perpetuating factors like biofilm, which is this protective slime, this matrix that bacteria and yeast will produce to make themselves 10 to 1,000 times more resistant to our topical therapies. They go into a quiescent state when they're in biofilm. They express multi-drug resistant changes in their structure. And so that is something that will make it very, very difficult to resolve the ear infection if we don't physically remove that biofilm from the ear. We've got things like a mineralization of the ear canal, otitis media and interna. And so all of these things can make it really challenging to clear the secondary infection if we don't get those perpetuating factors under control. And oftentimes that's when I'm talking about a video otoscopy or really more potent anti-inflammatory medications really need to bring the inflammation down. And so that's a conversation that we have when we're talking about the perpetuating factors is what anti-inflammatory medications are we going to use to open up that ear canal and reverse some of those perpetuating changes. And then lastly, we've got our predisposing factors. by themselves, predisposing factors are not going to cause ear infections. But if an animal has a primary disease, a predisposing factor can make them at a higher risk for developing more frequent or more severe infections. Those predisposing factors are going to be things like excessive hair in the ear canal. So our doodle breeds and also our doodle breeds are going to have a pretty significant predisposing factor. Our brachycephalic breeds have a predisposing factor of having a narrowed horizontal canal. If you think about the mild amount of inflammation that occurs when there is allergic otitis, that mild inflammation may not be a big deal for like a golden retriever who's got a pretty big ear canal. But if you've got a French bulldog whose ear canal is already almost completely closed because of its normal anatomy, then that mild inflammation causes major problems when the horizontal canal basically shuts down on itself. And so those predisposing factors are something that the owner should be aware of that can potentially put their animal at an increased risk. When I talk to owners about this, it really helps them to understand the complexity of this disease and helps them realize, yeah, I guess that's why this has been so tough for us to manage. But it's also something that I write on my care instructions. So I don't just write down otitis externa, right? Underneath otitis externa, I'm going to write down for the owner to very clearly see this is the primary disease that we're working on or what we're trying to figure out. This is the secondary infection that I'm seeing today. These are the perpetuating factors that we need to address. And these are the predisposing factors that make your animal at a higher risk for developing ear infections. So having that PSPP classification system laid out for owners, I think is very helpful for them. But also for me as a clinician, going back and doing those recheck exams, it's very easy for me to quickly pull up my last care instructions, my last medical record, and be able to see, okay, where are we at with the cerumen production with this animal? What's the biofilm situation looking like? Is it still really slimy in there, or have some of my anti-biofilm treatments been working to remove some of that slime? How's the inflammation? Is the ear canal open? Am I seeing less cobblestone architecture to the lining of the ear canal? Is it more smooth today? So it's a quick reference that makes me more efficient in the clinic. One tool that I use to teach owners about the PSP classification system is episodes 44 and 45 of the Your Vet Wants You to Know podcast. So for those owners that have really, really horrific ears in their dogs, that's something that can help them get a better understanding of what we're dealing with. But ears are tough. They're complex and frustrating for owners. So I think having a better understanding helps them buy in on the why of what we're doing to help their pet.
Oh my gosh, I love that because you're right. They are complex and especially because we have to do topical treatment, which our dogs love oh so much. And owners are hopefully not having to chase their dogs around too much, but potentially, that we hear the stories. My dog does it. I pull out the ear cleaner and he just like lays down on the ground. He's like, "No, why?" So it can be hard to get that buy-in to continue these treatment plans in the long term. And I think what you said is exactly right, that breaking it down for owners with that PSPP system to say there's all these factors that we're trying to address that are contributing to this infection continuing. That way, maybe we get the rechecks a little bit more consistently, which I will say I have found owners are pretty consistent when it comes to rechecking ears and things like that. But getting the buy-in for why it's so important, especially if we have to do multiple rounds of treatment or some sort of chronic management plan. I love that laying out the complexity and then again going back to these tools that can be accessed outside of the clinic to help create even more understanding. I think that can really go a long way to having good compliance and then seeing long-term success with our treatment plans.
Yeah, the compliance can be tough. And you're right. I hear that all the time from owners about the bottle of ear cleaner making the animal anxious or afraid, or if they just suddenly disappear. They're like expert magicians when it comes to that
Yes.
ear cleaning bottle coming out. I will say, I think we're very fortunate to be practicing in a time where there are a lot of options that we have for topical treatment for ear infections. And, trying to minimize fear, anxiety, and stress in my patients, particularly with ear ear disease is something that I really strive to do. So by performing that cytology, it gives me a really good idea of what topical is going to work best for this animal while I'm working on the underlying disease and the inflammation. And we've got a lot of different options to be able to be targeted based on our cytology. So when I put those leave-in medications in the animal's ear, it gives the owner an opportunity to have a simplified treatment plan, but it doesn't completely let them off the hook in my book, especially for those animals that were using those leave-in products because they have such a hard time with doing ear treatments at home. I want the owner to take that opportunity to mess with the animal's ears and to get the animal used to them kind of playing with them and touching them. And while they're doing that, that leave-in product that I've put in is helping to make the animal feel better. I'm also using pain medications. I'm using anti-anxiety medications. So I'm making that animal more comfortable for the owner to start establishing a routine where the animal's comfortable with that ear touching. That way, when they come in for their recheck exam and I see the infection's gone, we're doing really good, but we need to establish a cleaning protocol to make sure that we reduce the risk of recurrence of infection, that animal is a lot more comfortable with their owner already touching the ear. And one tool that I like to use for ear cleaning is instead of having the owner take the bottle and squirt it directly into the ear like a power washer, I have the owner go to the bandage section of their local pharmacy and just get some rolled cotton. Take a big chunk of rolled cotton, soak it with that ear cleaner, and then just gently press it up against the side of the ear canal till that solution drips down into the ear. And many of my anxious and fearful patients in terms of ear cleaning are much more amenable to this approach for ear cleaning compared to that bottle. So I think that's a really helpful tool for some of those owners that are struggling with ear cleaning. I also just have them take the bottle out on a more regular basis and give the dog a treat whenever they see the bottle. Then put the bottle away. That's it. Then the dog starts getting used to the fact that, oh, the bottle's out. I'm going to get a treat. Nothing bad's going to happen.
Absolutely. And gosh, I have so many thoughts on that. I love it because on the one hand, I think you're actually speaking even more to the complexity of this because we do have to take into account the human animal bond, the caregiver burden, and then the pet anxiety component of this, especially when we're talking about, say, chronic ears or something like that. And like you said, we have to think about pain medications, anti-anxiety medications, behavioral conditioning, and of course caregiver burden, which adds to the complexity of an already complex disease. Couldn't agree more with you about the cotton ball soaked and getting the ear cleaner in that way. That's worked for me personally and also a tip that I give to a lot of owners. So I love that. And then in addition to now having many options for ear treatment, which is has made things so much easier in a way, we also have a lot of options for behavioral conditioning. So, lick mats and things like that that we didn't think of as much before. I know my lab, who is laying at my feet somewhere, when he had to get acupuncture, he didn't mind the acupuncture, but he's a lab. He doesn't sit still. He doesn't know how to sit still. So we had this like frozen peanut butter ball that we would trap it in this plastic thing. I'm sure there's a name for this. He would just work on that for 20 minutes while he had his needles in, and he did great. And so I think we have to keep all of these things in account when we're making these plans of it's not just the primary condition, it's not just the underlying cause. There's a lot of like almost psychology that goes into it as well.
Yeah, I absolutely agree. And I think that's a great point of having that discussion with the owner too, making sure that they are comfortable with the routine at home. And this is a great opportunity to empower our technicians as well. My technicians are great at teaching owners how to do ear cleaning. They really love the behavioral aspect of it. I mean, the technicians, they're in our profession because of the human animal bond, because they love pets so much. And I think it's an excellent opportunity for us as leaders in the hospital to empower those people who really care about their jobs and help them to find meaning. When the technicians are able to teach owners how to do that ear cleaning and they see the owner come back and the owner is able to have performed that at home because of what they did, it really helps to keep those technicians in our field because they feel like what they're doing matters.
No doubt about it. I think that's such an important point. Let's shift a little bit into documentation. Otherwise, I could talk about the behavioral component of this for the rest of the day. The method that you've come up with for documenting what's going on with this pet and communicating that with pet owners goes a long way to just kind of breaking down the complexity of everything that we're talking about here. So, can you tell us a little bit about how you explain this to pet owners? How do you put this in writing, and what sort of advantages have you seen with that?
Yeah, so we started off this episode talking about the complexity of the disease, and it is definitely reflected in the care instructions that I provide to my owners, but I try and make it as simple as possible. One thing that I think can be overwhelming for pet owners is just having one long list of what our recommendations are. And so when we give our care instructions to owners, at the very top of my care instructions, it has my therapy and plan, which is a very brief blurb of what we discussed. Here are the primary triggers. Here's what we're going to do to try and figure out what your animal's primary triggers are. And then we go down into the actual recommendations. And so based on our discussion, these are my recommendations. And this is where I break it down piece by piece so that people know what they're using each specific part of our plan for. The first is for treatment of the underlying issue. And for most of my pets, when they come in for that initial consult, I'm usually going to be writing my diet trial instructions there, what food I want them to feed, how long I want them to transition for, and make sure they call me or email me if the animal's not interested in eating it rather than just giving up, because I have a lot more options. But usually the owner has already seen their animal eating that particular food in the exam room with me as I work on positive reinforcement for the visit that day and establishing what food the animal actually likes. So under our treatment of the primary disease, usually my diet trial is going to go there. If I have an animal who is on allergy immunotherapy for their environmental allergies, the allergy immunotherapy instructions are going to go in that section as well. But if this is just a really flea allergic animal, I'm going to write in that section strict year-round flea prevention. I live in Los Angeles and we are competing with Florida, I think, to see who has the worst fleas. I'm not sure who's winning right now, but it is a pretty heated battle.
I happily concede that title. Like I am not invested in winning that contest, but yeah, I feel like we stay pretty neck and neck.
Yeah. So when we're talking about the primary disease, that's where those things are going to go. Food, fleas, environment. That goes in that section. Underneath that, I'm going to have for parasite prevention. And because this, for me as a dermatologist, is also very helpful. And even though it is a primary disease, I want it to be its own separate category in my care instructions. Underneath that, then I have for treatment of itch/inflammation. And we could have a whole separate podcast episode on all the different antipyretic and anti-inflammatory therapies. But this is where we're going to make our recommendations for how to manage the itch and inflammation. So anywhere from Cytopoint, which is a really good anti-itch therapy, but really no anti-inflammatory action, to steroids, which are our big gun anti-inflammatory, and everything in between. That's going to go under that section. I will also include my topical anti-inflammatories there as well. So if I have some type of topical anti-inflammatory I'm doing to specific body parts, I'll make sure that that's written out very clearly in those areas. Underneath my for itch and inflammation section, then I'm going to have my for infection. And this is where my antimicrobial shampoo is going to go. If I have the animal on systemic antibiotics or antifungal medications, that's where that's going to go. Any topicals like spray, mousse, wipes, ointment, that's going to go in that section as well. So the owner knows how to use those tools to manage infection and where on the body I would like them to be implemented. Then I've got a section for ears. This is its own separate category because usually there's at least one or two things for the ears, and that may include ear flush, sometimes more than one. If I've got an animal with a heavy amount of cerumen, or if I've got a biofilm that I suspect is there, I oftentimes will use more than one flush to accomplish my goals. I want the owner to know why I'm using these particular ear cleaners. And then my ear medications, whether I put a long-acting medication or they're going to be doing medications at home, that's where I want the owner to understand these are your ear products and how we're going to use those. I will also put a lot of my behavior stuff around ears into that section as well. So if I want them to give gabapentin 2 hours prior to ear treatments at home, that's going to go under the ear section because it's very specific to how we're treating those ears. Gabapentin is a neuropathic pain reliever and anti-anxiety medication. The ears are innervated by cranial nerves. It's a really great tool for minimizing stress and pain associated with ear treatments at home, and something that I think we should be equipping owners with if they're struggling with those things. Then I have all of my other stuff that the animal may need based on their individual presentations. That may mean a whole section for anti-anxiety medications. We have data to show a significant increase in anxiety, aggression, touch sensitivity, all sorts of behavior problems when allergies flare. And so I need to address that problem because it is a sequela of allergic dermatitis. So that gets its own section. Then I have barrier repair if an animal has a significant barrier defect, and we need to provide tools specifically to support that skin barrier. If an animal's got conjunctivitis, then I need to make sure that I've got a plan for eyes as well. So these can get really complex. Oh, and weight loss too. Interdigital furuncles, they need weight loss plans. So I've got a whole section on weight loss, and it really helps the owner to clarify why we're making these specific recommendations. So yes, my treatment plans can become very long, but I think that detail and that clarity helps owners to understand the implementation process.
And I love the idea of providing that to the owners in written form. So, just like what we talked about with the podcast, they can go back when they're in a spot that maybe they have a question, or they say, okay, that was a lot in the exam room. And now I'm in a headspace where I can absorb this and understand this a little bit better. And they have it all laid out there in front of them. I guess my question would be, what would you say to a practitioner who said, that sounds fantastic. I would love to do that. I'm concerned about the time constraints and the time it would take to include that detail?
When I talk about all of this stuff, it definitely seems like, oh my God, that sounds like it would take a ton of time. I am an efficiency nut. I mean, I love trying to make myself as efficient as possible. And being a dermatologist, I talk about a lot of these things all day, every day. So this is not a situation where an animal comes in. This is the first time I'm seeing this condition, and I have to write everything from scratch. All of my medications, all of my disease information, all of my recommendations, I have snippets for within my medical record software. And so that's very helpful for me in terms of being able to very quickly put in like 3 or 4 letters, and a whole bunch of stuff populates for me. Every single medication has a snippet that very quickly populates how I like to use that medication and drop downs for different dosing. So that's something that I think is very helpful in just taking the time to establish those snippets so that when you have these complex cases come in, it really takes me no more than 60 seconds to write up that really detailed care instruction for the pet. But, it may sound complex and it may sound time consuming, but it's a muscle that you build and very quickly can get through as long as you have those systems in place.
Sure. No, I think that's such good advice with the technology that we have, kind of like we've talked about with the variety of medications, the variety of behavioral modification tools and positive reinforcement tools. The technology, has come a long way. So you're exactly right. A lot of us can do that just within our medical record system. And yes, initially it does take extra time to populate the snippets into the system in a way that you can pull them up quickly. But I couldn't agree with you more. Just speaking from personal experience, it pays off in dividends in the end. When, like you said, you can type 2 or 3 letters and away it goes. If your medical record system for some reason won't populate a snippet, there's a program called TextBlaze that I have used. And same thing, you just type a couple letters and away you go. And yes, you have to put in the time to set it up, but man, then you get so much payoff at the end with the time that you save.
Yeah, I was using before we started using our current medical record software, which has snippets incorporated into the software. Before I started using that particular software, I was using Text Expander, which sounds very
Yeah.
similar. And one of the things that I liked about Text Expander is at the end of each month, they would send me an email with how much time I had saved by using those snippets. It's hours, hours and hours and hours of my month that I saved by being able to implement something that was, it took me a little bit of time to write all of those out, but I basically just copied and pasted from, a care instruction that I had written. And then it's there for every other patient that needs that medication or has that disease process or had that procedure performed so that I don't have to take the time to write it out again. So yeah, it definitely pays off. And I liked seeing how much it paid off each month. I was like, yes, 10 hours.
Yes, I know. Could you imagine? Like, where would you have found those 10 hours? There's no
Yeah.
way.
Yep. At the end of each shift, I would be sitting there still doing my medical records and callbacks.
And so lucky that we don't have to do that anymore. Thank
Mhm.
goodness. But we digress here. Although I think that's an important topic too, because efficiency does matter quite a bit in these cases. I think we could probably continue for a whole nother hour talking about the complexity of this disease and the nuanced layers of treatment. Like you said, we could do a whole hour just on itch and inflammation alone. But in the interest of being respectful of your time and our listeners and everything like that, I've absolutely loved this talk and we've covered so much here. Is there something you want to leave us with? Like one thing you want to make sure that everyone listening to this episode knows walking away?
I think this can be a really frustrating disease. It's frustrating for the pet. It is frustrating for the owner. It is frustrating for us as the veterinary team. And so just taking a moment to acknowledge that can kind of help to relieve some of that frustration. The first step is acknowledging that it's there. And then being empathetic to the owner, being empathetic to ourselves, sometimes being empathetic to the pet too, because they can be cranky when they don't feel well, I think is very important. And that allows better communication between everyone. And that communication is a cornerstone to managing allergic dermatitis because this isn't a quick fix. This is something that needs long term management. And the better communication, the more empathy that you have, the more trust you have from that client and the better relationship you have with them. You know, we want good relationships with our clients. We don't want angry, upset clients. We want people who are happy to come back in and see us. I have clients that are happy to come back in and see me even when their pet is flaring. And that's because they know that I'm there to help. And we've already established an expectation of, yeah, your pet's disease is well controlled, but there will be flares, and that's okay. And so, just having this understanding that we are all human, this is a very complex disease, and having that open communication can be very helpful in managing that disease so that we can find the primary trigger and figure out what treatment plan works best for that individual. There is no one size fits all for allergic dermatitis. All of these animals are individuals, and sometimes it takes a little bit of trial and error to figure out the best treatment plan at that time and understanding that that may change over time too. And so it's just stay curious, stay empathetic, and just be kind to yourselves and to everybody else.
That's the perfect place to wrap up here. Certainly, I think we do have a lot of empathy for pet owners. What I've found hard with this disease is having empathy for myself when I'm struggling to get this under control, or, I've had an animal who's well controlled and all of a sudden, we're having all these complications and symptoms are coming back. To say it's complex, it's progressive, it's lifelong. This is part of what's going to happen, and challenges are going to arise. So yeah, I think understanding what patients are going through, the caregiver burden side of things, and then also really being, like you said, kind to ourselves and saying, this is going to be a challenge, and if you don't get it right on the first try, it's not because you missed something or you're doing something wrong. It's just because it's a challenge.
Tough disease. Absolutely. And, I want veterinarians to feel like they are empowered to be able to manage this. And so I talked about efficiency. Please check out the Your Vet Wants You to Know podcast is a clinical efficiency tool. It's helpful not just for me teaching my clients, but it's there for everybody to teach their clients. And one unintended benefit that I've found using this particular podcast is I've actually been able to train my support staff really well too, to use the language that I like to use when talking about this disease. So if you want to empower your technicians or your CSRs to be better able to discuss things like elimination diet trials or ear infections and ear cleanings. There are so many episodes on there related to allergic skin and ear disease, but there's also a lot of episodes that have nothing to do with dermatology. I've had a wonderful group of other specialists come on and talk about things that general practitioners are going to see day in and day out. So you've got a lot of different efficiency tools in the clinic. I hope this is one that fits into your toolbox also.
Absolutely. Absolutely. I'm so glad you pointed us towards that resource. I can see so many benefits coming from that. So, Dr. Lancelotti, thank you so much for joining me. This has been such a great conversation.
Yeah, it's been really fun for me too. Thank you.
Well, I want to say a huge thank you to Decra for making this episode possible. Dr. Lancelotti, thank you so much for joining me. I really enjoyed our talk. There was so many helpful take-home points to help clients better understand this complex disease process and ultimately end up with better outcomes for our patients. So thank you so much for joining me. Of course, a big thank you to all of you out there listening. If you enjoyed this podcast, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes like this, click on the Education tab on the Vetfolio website. Of course, we want to hear your input on this talk as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.